Good morning. It's Wednesday, November the 17th, and I'm Dr. Steve Stites, Chief Medical Officer here at the University of Kansas Health System, broadcasting live with you from the Dulles Simons Family Studio. Welcome back to Open Mics. On today's show, doctors are seeing more stroke patients than ever because of delayed medical care during the pandemic. You've heard us talk about that. Today, we're going to take a look at advances in stroke and interventional medicine. Plus, you've heard us say that faith plus hope and science will get us through. And we have the story of one man who teaches us to believe in miracles. So make sure to get your questions sent into us on YouTube, Facebook, and the Medical News Network. You find links to those right here on your screen. Hawkeye, This is Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control. If you've ever been with us, though, you know we call him Hawk or Hawkeye. Give us the morning numbers.
Yeah, numbers are holding steady, luckily. Again, we would like less, but I think what we have seen is an increase in the number of cases reported in the KC metro area. We know that hospitalizations follow that. Right now, our hospitalizations are steady. We have 18 active infections, but unfortunately, half of those are in the ICU, 9 in the ICU, 4 of those on the vent, and a total of 4 of our active infections are fully vaccinated. We still have 9 additional patients in that recovery period, so a total of 37, and Hayes has 10 active infections and 6 in that recovery period.
You know, the numbers are still a concern, aren't they? And we've got some graphs we want to show you this morning, folks. Let's take a look. The first one is just a detail. We've shown this to you before, and it talks about the number of cases of new cases in those who are vaccinated versus those who are unvaccinated. If you're unvaccinated, you're 6 times as likely to get the COVID as if you're vaccinated. But if you look at hospitalizations and death, 12 times as likely in the unvaccinated population. And that's really concerning to us, especially as we begin to face another surge. Let's take a look at the next slide. A few weeks ago, Kansas looked like the Southeast, where things were a little clearer. You can see where the dark purple is, and you've heard us talk about this. And you look at the Midwestern, far Western states, and then see it crawling across the upper Midwest, Minnesota, Michigan, Wisconsin, now Indiana, Ohio, looking at Vermont and New Hampshire. And the numbers that we see in those states on our next slide tell us that story. Look at the rise in these cases. Look at the percentages of increases in places of like 60%, 70%, 80%, 128%. Clearly in the throes of yet another increase. And it's not only one region of the country. As you see on the next slide, it's really throughout the country. The Southeast thus far has lagged a little bit, but it's starting to trend up. Everyone is trending up again. As masks come off, the weather gets colder, people go indoors. And remember, we go back to that very first slide, if you are unvaccinated, you are most at risk. And you know, it's funny because it feels like here we come again, right? How does that happen? Oh wait, is Dolly Parton in the studio? Here we go again. Oh my God. Just as we've begun to get ourselves together, I don't know where Dolly is, but she's right here. And that story, that song, Hawkeye tells a story for us, right?
You reminded me of Kenny Rogers. Just
I know. Well, I could be together. It's pretty awesome.
I mean, it tells
which of us is a Kenny and which of us is Dolly? That's what I want to know.
They're both great.
They are both great.
You know, I think it goes back to what we're saying. This is now a pandemic of 2 populations, the vaccinated and the unvaccinated. And it's certainly going to continue to impact the unvaccinated much more. We heard Dr. Fauci talk yesterday how likely by next year this will become an endemic virus, meaning it's just going to be here. But can we live with it? And what is the best way that we can live with it? It's not necessarily stopping the cases, but it's stopping the people from getting severely ill, having to go to the hospital, continuing to be off work, not being able to return to work, all of those things. The best way to prevent that, you know, we know that we have those pills coming. That will help. But the best way to prevent that is continuing the prevention methods, and those are vaccination. And just as you said, in those high circumstances, those high-risk circumstances, masking, distancing, doing all those non-pharmaceutical interventions as well.
The rules of infection prevention and control follow you wherever you go, and they keep you safe up until this moment and every day forward. If you just follow them, you can stay safe, especially when you're vaccinated. And we prove it every single day inside every health system across the country where people wear masks on our COVID wards and we don't transmit disease. I mean, the proof is striking on how strong it is. And it's also striking when you go back to those graphs and you see that the unvaccinated have a 12 times higher risk of death and a 6 times higher risk of getting the disease. This is indeed a pandemic and a tragedy now in the unvaccinated population. And as Fauci said, if we can get everybody vaccinated, we're going to get pretty darn close to normal. It'll be endemic. There'll be a small number of people who get sick, but it won't have to be like it is today, and we won't continue to see these surges every single year. Let's see if there's any questions out there from reporters right now.
Yeah, this is Dan Cohen at KSHB 41. I wanted to ask about the importance of getting people their first shot, while also the importance of getting people boosted, because I know the FDA is planning on authorizing boosters for everyone. Is one more important than the other, or are they equally as important as we move forward here?
That's a great question. Hawkeye, I'd say the first thing you gotta do is you gotta get your first shot, because you can't get back. You can't get your booster until you've had your first shot. So if I had to pick one, I'd say go get those first shots, because we know that starts the process of getting vaccination. Boosters, even without boosters, you still have a fair amount of protection against severe hospitalization and death. Not as much against disease transmission, hence boosting, but really that first vaccination is critical.
Yeah, I think if we had to prioritize, most experts would prioritize that first dose, and that is just to be able to at least start to prime your immune system. Yes, if you are young, you may be okay, but anytime you get this infection, you roll the dice with the complications, the worst of which, of course, being death. But we know what happens, and we know that anybody could be susceptible to those complications, and especially those things like long haul syndrome. But it's
50% of patients, we saw that yesterday, 50% of patients, and the overwhelming thing is chronic fatigue.
Yep, exactly. And so I think it is very important to really prioritize that first dose for those people that haven't yet received it.
Yeah, so important. Other questions or any follow-up there?
Yeah, I actually had one follow-up with Thanksgiving coming next week, and I know case numbers are ticking up, locally, but also in Michigan, Minnesota, Wisconsin. What's your concern there, and do you think boosting more people will help as we get ready for the holiday next week?
Well, boosting will absolutely help, and as you get ready for the holiday, if you're going to go indoors and you're around people who are not vaccinated or people you don't know their COVID status, man, I think you put the masks on, especially if you're in restaurants and bars and places like that. If you know who's in your bubble, you can control your bubble, that's a different question. I mean, our family is getting together. We know that everybody in our family who's going to be at that gathering has been vaccinated and has already had their booster. So we're really comfortable doing that. That's been our bubble for holidays since earlier in the pandemic. But I think for a lot of people, what we're concerned about is not so much just the Thanksgiving dinner, it's everybody coming to the dinner, especially from different areas of the country who may or may not be vaccinated, Hawk.
Yeah, I would agree. I think, the data is quite clear to me. If you are over 65 and you are more than 6 or 8 months out from your vaccination, or if you are in the immune compromised populations, that booster is definitely going to help protect you from the whole spectrum of disease of COVID-19, but especially going to the hospital and going to the ICU. If you are under that and you don't have those other immunosuppressed conditions, then your vaccination that happened early on in the year is still going to provide you sufficient protection against going to the hospital, going to the ICU. But is there that benefit, especially in those first 90 days or three months or so, of protecting you from even any diagnosis of COVID-19, any spectrum of illness, or even PCR positivity? And so I think that is what the CDC and the Biden administration is hoping, is that we can help reduce transmission in these times where we do expect higher transmission rates because of those factors that Dr. Stites had just talked about.
Other questions?
Dr. Stites, Dr. Stites, I have a couple of questions. One of them is from John. A reporter question. This week, the FDA and CDC are expected to discuss authorizing Pfizer booster shots for any adult. The question is, should they? The comment is this a good move as we head into winter with cases on the rise in Colorado, Minnesota, Michigan, and other northern states? Other states are already doing it. Is that a good move, or should they be waiting for federal approval?
So, here's what I would say. We learned yesterday with the Secretary of ASPR here that there is some liability protection you have if you wait for the approval, but I think many states are going ahead and forging forward, Hawkeye, and I have to say I think it's pretty clear the FDA and the CDC are both going to endorse boosters for everyone. So I think we're safe to say we're going to be boosting everybody. In fact, I think you already can. I mean, they're not turning down too many people at any place to get a booster shot.
I would agree. And again, yeah, the reality of the situation is most anyone can walk into a commercial pharmacy and really ask or get some other sort of additional dosing of an mRNA platform vaccination. But it's for those reasons that we had kind of explained in the last 10 minutes here.
2 questions from Donna. Is the news that Pfizer is asking for emergency authorization of its new antiviral pill, do you find that encouraging?
I find it great news. That pill looks really good. Now, again, we haven't seen, to Hawkeye's point, he always cautions me, we haven't seen the real evidence yet. We've only heard the company say their evidence. But credits to Pfizer. They've actually, everything they've said that they had data-wise, they then showed the data, and it was exactly what they've said. So I'm going to suspect that the same thing is true here. They've already said they're going to allow these pills to be produced generically in poor countries for a remarkably lower price. And I think that if you can reduce hospitalization and death by 85% by taking a pill once you're positive for COVID, I think that's really good news. Actually, I think it's a game changer. Vaccination plus the Pfizer pill, antibodies if you're really sick or if you have a compromised immune system, and masking when you're in a high-risk situation. I think that is going to be our way out of the pandemic, Hawkeye.
Yeah, I would agree at that point. And I think, wasn't this trial stopped early?
It was
because
stopped
of the
early.
massive benefits.
Yes.
So usually a trial can be stopped early if it shows no benefit or it is detrimental. This one was actually stopped early by an independent safety monitoring board, which are so important in these trials because of the extreme benefits that this showed. So I think that is very encouraging. It wasn't Pfizer who stopped. All of these trials have independent safety monitors, and so I think that is certainly encouraging.
Donna has one more question, and she recognizes that this is something we have talked about before, but it needs to be repeated. Are you concerned about the rapid rise in COVID cases in Kansas and Missouri right now? Are you concerned that this will come as more communities are doing away with mask mandates? And any hope that getting more kids vaccinated, do you think that will help lower the numbers?
Yeah, all those things I think are true. First of all, we talked about the wastewater testing that was out of Lawrence a couple of days ago, where it showed the highest levels in wastewater of COVID-19 or SARS-CoV-2 in the entire pandemic. That's a bad sign, right? Because we know that those spikes usually predict an upcoming surge over the next several weeks, and we're starting to see case numbers rise in Kansas City already, and I think we're going to continue to see them rise because we're seeing. We showed that graph earlier, that photo earlier from the New York Times, demonstrating the march of the virus across Kansas into Missouri now, and so I think we have to beware that indeed, as masking comes off and another surge comes our way, that the unvaccinated, and it's still about half of our population, are at risk. And the more people that get vaccinated, and yes, that includes the 5 to 11-year-olds, the better off we are. But are we at risk? You bet we are.
That's it from me.
All right, let's turn to our guests. Folks, we have some pretty cool folks here today. They are incredibly accomplished. They do amazing work. Dr. Koji Ebersole, the Director of Vascular and Neurosurgery, is here at the health system. Dr. Alan Reeves, our head of the Interventional Radiology program of the same sort. Good morning to you both. This is pretty cool to have you guys here. I am thrilled. Dr. Ebersole, let's start with you. Let's talk about the impact of the pandemic has had on stroke patients and on your all's practice.
Oh boy, well, it has been a big ordeal for us. I think it was under the radar that we are first responders in encountering COVID patients. When a patient comes with stroke, it's an emergency, time-limited emergency. The faster you can fix their problem, the better they're going to do. There's no time to assess these folks for COVID. Whole team is at risk. We had to take unique precautions to try to protect everybody through those early stages. And then we found, importantly, that our emergency numbers were rising in a dramatic way because underreported, in my opinion, is that COVID causes strokes. This is a dangerous combination. I was on call 2 weeks ago, and 2 patients with COVID I had to treat. One, my age, large obstruction in a blood vessel in the brain. We were able to open it, but his subsequent hospital course was unrecoverable. Just too many things happened simultaneously with COVID, and stroke is a very severe manifestation of this disease, and it has impacted our practice in a substantial way with the burden of emergency dramatically escalating, and then meanwhile the things that we really love to do, which is the elective procedures, helping patients plan their lives around their vascular conditions, those numbers are depressed because there's such a morass of these emergencies. clogging our infrastructure.
Yeah, we've seen that for sure. We know that people are delayed getting to time-sensitive diagnoses. Do you think people were delaying coming to care because they were afraid of COVID?
Absolutely, that's the case. I think we see that in our elective practices, that we would have a steady growth of patients looking to treat carotid stenosis, aneurysms, vascular malformations of the brain. Those fell off a cliff during the pandemic because people in general, in my opinion, were afraid to come to the hospital. When there's such a dangerous problem, widespread in the community, you have to triage where your priorities are. And in my opinion, the general public was not taking care of their preventative health the way that we would like to.
Yeah, and we did see a worsening of the patients who did come in with stroke. They were in a more advanced phase, couldn't do as much about it. So that's always a fear. Has that gotten any better?
I think it surges the same way that you folks see.
Yeah.
And we can feel it. We are transferring patients from all over the region to have this emergency high-level care. And it's time-sensitive diagnosis. And we know that the surge is happening because the patient is not coming to our hospital in a timely manner. What's the explanation? The transferring facility cannot find an ambulance because all of the ambulances are out in the community dealing with emergency COVID patients. We can feel the ebb and flow, and it's dramatic and concerning.
Yeah, and I think you've also raised a great point about the risk of stroke in patients, and I'm going to come back to it. Are you seeing that from people who get just routinely vaccinated, lots of strokes, just from a vaccination itself?
Strokes from vaccinations, we have not seen it.
Oh, thank you. Just to be fair, just to make sure everybody hears all that. Dr. Reeves, lots of new technology. Talk to us a little bit about some of the technology that y'all use in the room to help save lives.
Sure. We are incredibly well suited here. Our technology is literally top of the line. We rely heavily on large, expensive equipment to do our jobs effectively. Essentially, what we have to be able to do is look inside the brain from two different angles to do our job. So if you're talking about an acute stroke, we are navigating small instruments into 2, 3, 4 millimeter vessels. That's not very big. I mean, that's less than half of your fingernail. So
that's really small, dude.
It's very small. And we're putting a lot of equipment up inside a person's brain, inside their blood vessels. These are delicate structures. So if you combine an already delicate procedure on top of the fact that people have COVID, their vessels are not acting normally to begin with, you need very specialized equipment to be able to visualize and see and avoid complications. So that comes in the form of biplane rooms for us. What that means is specialized, very powerful X-ray equipment that can look into the brain from two different angles at the same time. So we have to think spatially, we have to think volumetrically, we have to imagine and conceptualize a 3D image while we're working, because what we're doing is navigating small instruments from the artery in the groin all the way up to the brain. And so we have to be able, in our mind's eye, to visualize the blood vessels as we're working on it, but at the same time have equipment that can view down to millimeter and 2 or 3 millimeter level of specificity. So we are fortunate that KU has put a lot of resources and talented people into making sure that we have that equipment. And we run this equipment 24 hours a day, 7 days a week, all hours ready to go. So much so that we are actually putting in a third biplane room in order for us to accommodate the number of strokes and the readiness for us to treat the people, the community, and the state of Kansas at any moment.
Yeah, that's amazing that you guys, it's kind of like y'all have to be like wizards here. I'm just saying, because maybe y'all are just like artists, because I look at that and you talked about that depth perception and how you have to see these things in tool planes. And, you know, when I was ever trying to draw anything, it never looked very good. I could never do anything like that. Give me a fly rod maybe, but not the tools that you all are using. Jess, I understand, though, that we have an amazing story about the intersection of faith, hope, and science. And just to say, we've turned that phrase here a lot because we've tried to make sure we encourage folks to get through this pandemic, waiting on the science, and then here's science, and here's some amazing stories. And just remember, faith, hope, and science are the way we save lives in the pandemic with vaccination, they're also a way we save lives and people are having strokes. Let's hear the story, huh?
I know, that's right. You say that all the time. Faith, science, two of your favorite things. And this story has quite a cast of characters. We've got a husband who got some horrible news, a wife tasked with a monumental decision, a gifted neurosurgeon, and a big brother who happens to be the architect of the COVID-19 vaccine. Alexis Del Cid brings us the tale that, by all accounts, has a miraculous ending.
Diagnosed with a rare fusiform aneurysm, found in less than 2% of people who get aneurysms. Diagnosed with a rare fusiform aneurysm, found in less than 2% of people who get aneurysms. Even worse, it was in an incredibly rare place in his brain.
The aneurysm needed to be treated because sooner or later it was going to be catastrophic.
This part is abnormal. That's the aneurysm.
Dr. Ebersole is the director of endovascular neurosurgery at the University of Kansas Health System. He advised Chris to take part in a clinical trial of a special stent that could treat this specific tricky area. Chris would be only the 4th person in the world to get it.
So what we wanted to do was use a device that's very similar to a braided hose.
16 months later, on an evening in early September, Chris prepared for an early morning surgery by writing a letter to his wife, Janet. He placed it in an envelope that no spouse ever wants to see sitting on the kitchen table.
It says, in case the surgery doesn't go as planned.
Talking about his letter is still hard.
We've had a good life, and I just said she would be fine.
Neither had any idea how close Janet would come to opening that letter. Once Chris was under anesthesia, doctors realized he was part of an even slimmer minority. Chris had suffered a silent stroke years earlier, disqualifying him automatically from the trial. Dr. Ebersole had to make a very quick decision: abort everything, and Chris would have to wait another 5 years till the device was out of trial and approved, or use a different device on Chris's brain, a device immediately available but never rigorously tested in the tricky blood vessel where Chris's aneurysm was located.
When Dr. Ebersole came out, I thought, I can't believe this is happening.
Enter Chris's big brother, Barney.
I told Janet, we're just going to claim that he's going to be okay.
Chris had told Janet to call Barney if anything went wrong.
Probably the smartest person I know. He's just has a gift of explaining things in a simple way. I call him Big B. He's my big brother. He's like 6'5", so.
It's at this point of the story we should probably tell you that Big B...
When we were wrestling as young children, he called me Big B because I was always beating him.
...is kind of a big deal.
George Bush came and visited his lab once and called him Big Barney.
Big Barney is Dr. Barney Graham, listed in Time magazine as one of the 100 most influential people of 2021. Influential because Dr. Graham created the Moderna vaccine, something he downplays.
I'll tell you, having influence with prayer and with your faith and seeing your family recover in ways that are not expected by others, then that's the real influence.
Back to little brother Chris, who's on the operating table and the clock is ticking.
He was already asleep under anesthesia. We already had the instruments in place. And importantly, we had a world-class team that had traveled here to help oversee the clinical trial.
They decided to go ahead with the procedure. But after the procedure, when it was time to bring Chris out of anesthesia, life threw them yet another curveball.
And when he started waking up, one side of his body was fully awake and the other side was not moving at all.
He called me that night, and you never want your neurosurgeon to call you at 8:30 at night. I was still driving home from the hospital, and he said, I want you to be prepared for the worst.
Janet, who does extensive missionary work with Chris, called, texted, and emailed their global network asking everybody to pray for a miracle. And back at the hospital, Dr. Ebersole threw everything but the kitchen sink at Chris, including aggressively thinning his blood, raising his blood pressure to a supernatural level, and putting Chris back on a breathing tube. He went home later that night with a heavy heart, and when Dr. Ebersole returned the next morning, a nurse ran up to him with news that could have knocked him over with a feather.
Christopher Graham is perfectly fine. What are you talking about? There's no way. You must have gone to the wrong patient's room.
It truly was absolutely amazing from no movement the night before.
Almost how I had envisioned it, he reached out his right hand and talked to me. I think he said, "Hi, Big B." And
Really?
that was his first comment to me.
Honestly, I didn't believe it. I had to shed some tears.
I have a very strong faith. And
I can explain it scientifically, but I'm perfectly fine calling it a miracle.
Chris is expected to be absolutely fine. He's out of the hospital, the stent worked. And Dr. Ebersole says sometimes when people who've had strokes go under anesthesia, it can temporarily re-trigger stroke symptoms. And he says the aggressive treatments they applied in the hospital helped as well. Chris and Janet say they plan to devote more time to their missionary work across the globe because clearly Chris's work is not done. And as for Big B, Dr. Barney Graham, he says his brother's story is just more proof to him that science and faith coexist for the good. I'm Alexis Del Cid.
Koji, that's a pretty amazing story.
Thank you. Yeah, it was amazing.
Faith, science, hope, miracles.
Yeah. Well, it was very emotional because we made the decision on his behalf. He couldn't speak for himself. He was asleep under anesthesia, so Barney and Chris's wife and I together thought that the right thing to do was to treat with a device that was available since he ruled out of the clinical trial on the table while he was asleep under anesthesia. We were all convinced that the aneurysm weighed so heavy on his mind that he would not be willing to wait for the results of the clinical trial, which would be multiple years down the road, and he would have pursued the treatment that we had the opportunity to do at that moment. And the reason we decided to go forth was we were never going to have the support available to make the procedure as safe as possible. The world-class team had traveled here to support the fourth use of that new device, but that same team is the one that designed the device that we ended up utilizing. The procedure went perfectly fine, and that traveling team went down 39th Street to go get barbecue at Q39 while I'm waiting with the anesthesia team for Chris to come out of anesthesia. And when he wakes up, it's very obvious that his brain was not tolerating what we did to it. And when you see it that profoundly, that one side of the body is moving very freely and the other side not at all, that is almost always a situation that can't be recovered in an important way. I was convinced that we had changed his life in a dramatically negative way by our decision. And it weighed so heavy on my mind that his wife would have to carry that burden that she made that choice. It was hard times. And so I told her, this was evening now, that I was aware that she had an incredible support structure, that she should leverage those things. And she did exactly that. And by a short number of hours later, her whole family was here. Barney was here, the kids were here. And in the morning, when they were going to take the breathing tube out, I was expecting them all to be there to support the fact that his life was going to be completely different because half of his body would not work. And when they took the breathing tube out, it was literally miraculous that everything was there. And he looked around the room and he knew something must not have been right because there was his whole family here and they do not live in Kansas City.
He thought maybe he was in heaven right then.
Yeah. When I was told that he was perfectly fine, I was convinced that the nurse went into the wrong room. When you see that degree of asymmetry in somebody's neurologic function, that is not a recoverable state. So as you saw in the video, yes, I can explain it, but I am fine calling that a miracle.
It kind of feels like that.
I agree.
The whole anesthesia thing, that just doesn't happen too often with anesthesia. So it's an incredibly rare complication.
For it to be that dramatic of a presentation was striking. I have never seen it that advanced, and that's why I was convinced that we made the wrong call. I'm glad we were obviously mistaken.
Ellen, miraculous story. But you guys see kind of a lot of miracles. You help with miracles every day with different patients. Talk to us a little bit about how profound of an effect that can have.
Well, that's an incredible story, and I'm proud to just sort of be a part of the same team that helped participate in that. It's remarkable even just to hear it and see it, even though I knew it was happening at the time. I don't think that any of us, Koji, my other partners, our stroke neurology colleagues, the nurses, the techs, everybody that contributes to making our team whole, I don't feel like any of us feel like we're working miracles or we're witnessing miracles. I feel like all of us get up and go and do our jobs every day. And that's what it feels like. It's not a normal job. It's not a job, a 9-to-5 job. I get that. But I think to us who have participated in building this program and engaged really our life's work in this, to be honest with you, I think it feels like not something where we're going to work and expecting to see miracles. I feel like all of us feel like it's going to work and doing what we're supposed to do. And when we get good results and great results, it is deeply gratifying to see that. And it's not true just for Koji and my partners, it's true for the whole team. We can see it. I was on call this past week, and a gentleman came in, 62, and he had a clot at the very top of his carotid artery. Well, the carotid artery is the big blood vessel that supplies blood to your brain. You need it. You need it every second, every minute of the day. And this clot was sitting at the top of his carotid artery, and it's essentially acting like a giant cork, preventing blood from getting to the brain. And he was having significant symptoms. In fact, the exact same symptoms that Koji's patient had. He couldn't move one side of his body and couldn't speak. These are dramatic things. These are not minor things. Anybody can recognize this. But the team was rallied at midnight, and we came in and we did our job using the equipment and the resources and the training that we all have, and we were able to get the clot out. Blood flow was restored, and the next day he woke up as if nothing happened. So I can see how this could be viewed as a miracle or an amazing event. To us, it doesn't feel that way. It feels like this is what we do. This is what we're trained to do, and we want to do it, and we enjoy doing it. And it is such a collaborative team effort to do this. And I don't think any of us take for granted the dedication that the other members of our team have for this. This never rests on one or two individuals. It rests on 10, 15 individuals that really want to make this work for us and our system. So that's a really long-winded answer to your question about miracles. It's not how we see it. I think it's just what we feel like we're doing.
The patients can have the faith. Together we have the hope, and then y'all bring the science. And that's the combination. Whether it's a pandemic, it's a stroke, it's the operating room, wherever you are. And that biplane operating room is especially a pretty cool story. Lots of magic. We saw those pictures earlier when you were talking about that. So anything else you want to tell us about that room and how it came about?
Do you mean the new room or the ones that were?
Yeah.
Well, the new room was just a function of necessity. The volume of strokes that our health system has seen literally since 2009 has almost gone tenfold since 2009.
Yeah.
Literally tenfold. The amount of interventions, which include TPA and the stuff that Koji and I do. So it became a matter of necessity that we had another room that had to be built to serve our needs and to serve the state's needs, and for us to be able to do our job 24 hours a day, 7 days a week.
And it takes a team, right? It always takes a team. Jess, I bet there are a few questions out there about some of this COVID or about what were you talking about here with strokes?
There are. And I have to say, I've done several stories with Dr. Ebersole, and they always come through. Dr. Ebersole has performed yet another miracle when we get these stories that come into down here in media relations. So it's just like, yet again, it has happened. And one of our viewers had mentioned, just called it kind of this, Daryl was watching the story, he said, wonderful illustration of how faith, hope, science are assessed to maximize patient care. And he called it kind of this patient trifecta. So great example of that. I just wanted to read his comment. So Gail was wondering, I'm wondering what the patient's symptoms were to discover that he had an aneurysm. Do we know what type of symptoms might have arisen?
Sure. I think it's surprising to the general public to know that most aneurysms don't cause symptoms whatsoever. The reason is most aneurysms are small, on the order of the size of a pea, on the blood vessels in the brain. The brain has no pain fibers, no sensory fibers. The brain has no idea that the aneurysm is there. So for most patients, if they find out that they have an aneurysm, it's typically for a completely unrelated reason. Having trouble with their sinuses and they get a CAT scan. There's dizziness or something with the inner ear and they get a CAT scan, and they find these things. When you find that aneurysm, then you need to meet somebody who's practiced in this art to talk about the implications of that. Because also, I think it's surprising for patients in the general public to learn that brain aneurysms are a common thing, and the vast majority of them do not cause trouble and do not need treatment. They need responsible observation. So Christopher's case, the aneurysm came to attention incidentally, not related to a symptom specific to the aneurysm.
Did I hear you right, Dr. Ebersole? Did you say not all aneurysms need medical attention? They're not all as bad as they sound? Because that sounds like a scary word.
I know. I think that's one of the areas where there's an information gap between what the public understands about aneurysms and the reality of their behavior. 10 million people in the United States have brain aneurysms. Most of those 10 million are going to live their entire lives with no event from it. The reason why they carry such heavy weight with the public is because if an aneurysm does cause trouble, it's going to be the most dramatic health event you face in your life, because it will cause sudden bleeding on the brain with no warning, and the consequences are essentially determined within 30 seconds of the event. There's nothing you can do about it. If it spills a lot of blood, you will lose consciousness, fall into a coma, and not be able to awaken from that. If it's a small amount of blood, you can make it to a hospital that has the capacity to treat an aneurysm, a place like KU, and you have an opportunity to potentially return to a normal life. But that emergency event is uncommon. A large portion of our practice is to try to prevent patients from experiencing that event in their lifetime. But of the 10 million people with brain aneurysms, the vast majority do not need a treatment, and a very small percentage of them will experience an emergency event in their lives.
You know, it's a crazy story because historically, I grew up in the time when the only thing we had to do was take people to the operating room.
Yeah.
And to think we've come so far with interventional techniques like what you've described, Alan, that is science.
Yeah, and in the field of aneurysms specifically, there's been a remarkable change, even in our ability, since I got out of training and Koji got out of training, the amount of influence that industry and effort that industry has put into developing these micro tools to treat aneurysms has skyrocketed. So it has transformed our ability to treat an unruptured aneurysm. Ruptured aneurysms are the ones that have the dramatic medical event where somebody is going to fall to the ground. And we have always been treating those, often with the same methods that we use now. But our ability to treat the unruptured aneurysm, the one that is discovered by accident, if you will, has completely transformed over the last 6, 7, 8, or 9 years, allowing us to treat more and more people safely.
Yeah, that is hope and science. All right, Jess.
Okay, a few questions here for our doctor specifically. Isaac wants to know, if the brain has no receptors, what causes headaches? I'm sure there are a lot of people who wonder if their headache is a stroke or something more serious.
That's a good question. I don't know the answer to that. Okay, experts.
Right. Well, let me tell you, in the setting of an aneurysm, if you get the classic headache that is the harbinger of bleeding from the aneurysm, it is a very unnatural type of headache. It is the sudden onset of the worst headache you've ever had in your life. That's described as a thunderclap headache because it comes on like that. No escalation over the course of multiple hours in the day. It is a sudden event. This is blood under arterial pressure escaping from the broken aneurysm into the enclosed space of the skull. In seconds, dramatically elevating the pressure inside of the skull. That stretches the lining of the brain. The lining of the brain is exquisitely sensitive. This is where the headache from aneurysm comes from. Headache is one of the top reasons that people go to see their doctor. And the vast majority of these headaches we don't have a mechanical explanation for, meaning it's not a large aneurysm causing the headache, it's not a big tumor causing the headache. It is multifactorial and in a lot of ways mysterious. We do not know the biology for the majority of headaches. So when you work with your primary care doc, they will try a combination of approaches with different medications to help you tolerate your symptoms. And if they reach a point where they're encountering roadblocks, they'll send you on to a neurologist who is the headache specialist. But an aneurysm headache is a rare and unnatural phenomenon. And so patients in the general public should not be worried that a chronic headache has a relationship to an aneurysm. That is not scientifically supported.
You know, that was an impressive finger snap. Can you do that again? That is so loud. Do you have kids?
Yes.
Are they afraid of that finger snap?
I haven't used it. I'm going to try it.
I mean, that's a snap. I can't do that, Jess. I'm like this. It's kind of sloppy.
All right. I love it. So Sarah wants to know, I have stenosis of the vessels in the brain from IIH. I'm not sure what that is. So tell us what IIH is.
Alan, what do you think?
Does
What's
stenosis
IIH?
put you at higher risk of blood clots from COVID?
Well, IIH is an interesting diagnosis that I think that we've become a lot more aware of over the last 2, 3, or 4 years, including our ability to treat it with some of the micro techniques that we've discussed in the show today. That particular entity, it definitely does lead to headaches, by the way, and we do have more effective treatments now, such as putting a stent in to open up those stenoses. That particular therapy and interventional technique has begun to gain widespread acceptance as an ability to treat these people's headaches. The relationship between that and blood clots, it's loose, but there is some. Most people typically have headaches with this type of disease process. And the relationship to COVID, I'm not aware of a relationship with COVID with that. But it's a possibility that people have vascular symptoms related to COVID, although I'm not specifically aware of a relationship between IIH and COVID in terms of the stenosis in the brain.
All right, Bridget has a question. It has lots of big doctor words, so bear with me and just help us break down, and you know how I do with these words. Okay, Bridget says her mom has recently had 5 syncope or near syncope episodes.
Syncope, go ahead.
Syncope. Okay.
Well done.
Sorry. Okay, syncope episodes.
Hey, that's pretty good.
We're
Don't
learning.
worry.
She underwent Doppler testing and noted elevated velocity of the distal left interval carotid artery.
Well done.
Likely due to torosity of the vessel, not plaque. So the question is, they're now waiting MRI results. How likely is it that a stroke could occur while they're waiting for those results?
Yeah, don't you? Those folks get those kind of results are like, what do all these words mean,
Yes.
Koji?
Yeah. That is definitely the type of sophisticated analysis that you want to have the face-to-face conversation with your team that is ordering those tests to help you walk through it. But what's described there is they are using a non-invasive test to assess the blood flow through the carotid artery. And based on what you read there, they are not finding a specific narrowing, which is an important finding. If you have narrowing of the carotid artery, it may be that you would benefit from a procedure to improve the caliber of that vessel to optimize blood flow. You're describing tortuosity led to alterations of blood flow. That is considered a normal anatomic variation and often best managed medically, not requiring a procedure or a surgery for correction. But I would say all of those things collectively are unlikely to be the explanation for recurrent syncope. And the reason is syncope is a much more global process, whereas tortuosity of one carotid artery would affect a very specific part of the brain, half of it at a time, and that does not lead to syncope. It leads to recurrent events of weakness or numbness on one side of the body. So what has been described there is one test in a broader workup to try to explain the symptoms. To me, that specific test is simply going to rule out the vessels of the neck being an important contributor. The source lies elsewhere.
So I think it is an important finding. Go get it evaluated,
Exactly.
but it's probably not causing the syncope.
Exactly.
Go get that evaluated. Jess, one more question?
Syncope. Okay, I got it. It's in my head. Okay, last one is from Lenora, and I just want everyone to know we've got a lot of COVID questions, so we'll get Dr. Hawkinson on those tomorrow and Friday. But
Okay.
Lenora has a lung question for you, Dr. Stites. I had all 3 of my vaccines. The last one was in mid-August. My lungs are showing hazy areas that had not shown before. Doctors are not sure what this is. I heard about vaccines affecting what you see on mammograms. Have you heard anything about lungs being affected temporarily?
Yeah, no, I don't think that's those. I think those are true, and unrelated. And so if you have a haziness in your lungs, you've obviously had some reason to get an x-ray, so you must have had some symptoms. They're trying to evaluate that. If anything, if there's a process causing that, and that's not an uncommon process, by the way. Lots of patients can get for different things. We call them infiltrates in the lung. Vaccines don't cause that. Other diseases cause that. Actually, glad you're vaccinated, because those same diseases that can cause haziness of the lungs can make you more susceptible to COVID-19 and more pulmonary complications from more lung complications from COVID-19. So make sure you talk to your lung specialist, go get those things evaluated, figure out why it's there. But I would not be concerned that that's caused by the vaccination itself. Hawk.
Yeah, I wouldn't see a mechanism there. Again, really all of that reaction takes place locally at the tissues and in the local lymph nodes as well. And I think with the mammogram changes, Steve, if I remember correctly, I think it was just really near around the lymph nodes that they can see it, rather than the actual breast tissue itself. So certainly get that checked out. I'm sure there will be a CT scan coming in the future for that, but I don't see a mechanism for the vaccine causing those changes.
Yeah, I don't think so at all. All right, guys, we're going to round the table and collect some final thoughts. Dr. Ebersole, I'm going to start with you.
Oh, I was just happy to be here with you guys, talk about the work that we do. The dedication that KU has to the highest levels of medicine is, I think, exemplified by our group. Our team has outstanding personnel, and they do not have to do this job. They could pick something that requires less dedication and do fine in terms of raising their family and having improved quality of life. They choose these things because they're passionate about these diseases, and they know that you need good people to get the outcomes that are possible if you really leverage good people with outstanding technology. I'm very proud of what we've built here, and we appreciate KU's support.
Yeah, well, thank you. And good people, good team. Dr. Reeves, final thoughts.
Yeah, I would kind of echo that. You know, a lot of times people ask, hey, Dr. Reeves, how you doing? And I just say, oh, I'm just happy to be here serving the good people of Kansas City. But now that I sit here and talk about this for an hour, I really am happy to be here serving the good people of Kansas City. It's an exciting time to be doing this sort of thing.
You know, for those of us who, again, I'm older than y'all, but see, we had a patient coming in with a stroke. What did we do about it? We watched it. There was nothing we could do. And see the trends, well, shoot, back then there were nothing you could do about heart attacks except give nitroglycerin and maybe some aspirin, and that was new back then, and a little bit of heparin. But to see where it's come from and to watch y'all evolve this team and see how many lives are so positively impacted by you guys and your team, and it is a team with a capital T. Congratulations. That is truly the delivery of what science, and then a lot of people working hard for a lot of years to set those platforms up, can help us do and help us achieve to stop strokes. Thank you all so much. Thanks for being here today.
Sure.
Thanks for telling
thank
your
you.
story. Hawk, final thoughts.
Yeah, I mean, after listening to your esteemed guest, Steve, I think I need to go back and do some training and really learn to help people like these two specialists do. But I think I'll echo Dr. Ebersole's comments and Dr. Reeves as well. It's just the people that are here at this health system have done their training. They have put in their time. They do it day in, day out. And we just want to thank those nurses, those therapists, the people in environmental services, the people bringing the food, because this health system, this hospital, runs smoothly because everybody is here doing those things. And we know that our workforce is stressed out to the max because of lack of employees and lack of help. So everybody is doing overtime and what they should be doing to help you and your family when you come in here, to help make your quality of life better and get you better.
You know, isn't it a recurring story that together we can? And in this case, it's really about the rise of our ability to transform how your lives are affected through stroke. And that's so true. So often in medicine we've come so far, but it's because in the way it can work is you have to trust the science. And you have to trust the folks who are delivering the science. You have to trust the team of people who are helping taking care of you. And you have to trust yourself to have the faith and the hope to believe in the science that makes us better and stops the events that can lead to a catastrophic stroke or heart attack or other ways. You have to trust vaccination. The numbers are out there. They're rising. Danger's lurking. And all you have to do is trust the science one more time. Jess, tomorrow.
Hey, are you on with us tomorrow?
You know, if I can get, I'm on rounds this week, and so I have to get done rounding really quickly. If I can get done, I'll be down.
Well, you know what we're talking about? We're talking about beauty, myths, facts, and trends. And I'm not letting
Well, you know, that's me right there.
It's
I got
all
my
you.
vest on. The trends are back, man. It's going to get cold. Trends are back.
No, I'm telling you, I need you to tell me right now, just in case you can't be on tomorrow, what is one thing that you do to make you this beautiful? What do you manscape?
Seriously.
Do you moisturize? What do you do? I'm asking you. You have to give us one of your tips. Is
I
there
take a
anything
shower.
you do?
I take a shower.
You take a shower, okay.
I eat right, sort
Okay.
of. I shave in the morning.
You shave, okay, there's your, okay.
Uh-huh.
All right,
Yeah,
do you
that's
know what
my
a
big
jade,
tip.
do you know what a jade roller is?
No.
Okay, you're gonna learn, so come in tomorrow. Okay.
Oh, Lord, here we go.
Okay, so people are taking
Listen,
all this
let me
collagen.
ask John Lithgow what he thinks.
Okay, see? He's a movie star, so he's got it going on, so do you. Okay, so people are taking collagen powder. I have done it, I admit. People are using their jade roller. People are even changing their pillowcases. But the question is it really working, or are people just throwing their money down the toilet? We break down some common beauty myths for women and men, and you might be surprised. Also, we've got some great kid photos that have been coming in, so if you sent them to me, we're gonna show all of those tomorrow, and we wanna see your kids and grandkids as they get their COVID-19 vaccine. So send your pics and videos through our Facebook Messenger, or you can send them through KU Hospital News, or email them to medicalnewsnetwork@kumc.edu. And don't forget, catch our show anytime on Facebook and on our YouTube channels. We're going to see you tomorrow at 8 a.m. sharp. Have a great Wednesday.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.